Even as the confirmation of a new COVID-19 variant in Guyana by local health authorities seems to be shrouded in secrecy, the Pan American Health Organization has for the second time validated that the sudden spike in new infections and deaths in Guyana is because of a more highly transmissible and potentially deadlier form of the virus. In April, Director of the Pan American Health Organization, Dr. Carissa Etienne, had hinted that the surge in COVID-19 cases in Guyana is due to a new variant of the virus. While she did not divulge which of the variants was behind the surge, advisor on emerging viral diseases at the Pan American Health Organization, Dr. Jairo Mendez Rico, recently listed Guyana as one of the countries in which the virus is present. During a webinar, Dr. Mendez Rico highlighted that 37 countries in the Latin America and Caribbean region have confirmed the presence of one or more variants of concern, which include the United Kingdom's B117, South Africa's B1351, Brazil's P1, and India's B1617 variants. Even though local health officials have not completely denied the presence of a new variant, they haven't confirmed it either. Instead, Minister of Health Dr. Frank Anthony has indicated that the country has in store a set of samples to be sent abroad for testing, after which a pronouncement will be made on whether or not mutations of the virus are here. Head of Medical Services Dr. Mahindra Karpan, in a recent interview with Nightly News, revealed that there's a strong likelihood that the Brazilian variant is in Guyana, but until it is proven through results from CARFER or other reputable labs abroad, there is no need to restrict travel from other countries.
And I'm not sure that that is the best option, because we see, even in places that have done that, in our neighbors in Trinidad, there is still a surge in cases. So I'm not sure that we have adequate and sufficient evidence to pursue that approach. So it's almost an impossible task, given our resources, to shut us off from the areas of known traffic.
However, Shadow Health Minister Dr. Karen Cummings is adamant that now is the time to implement aggressive measures to contain the spread of the new variant. One such measure, she expressed, is the immediate closure of the airports.
And so I think we should close the airport just for 2 weeks and see what happens, because others have done it, and we're talking about there were CARICOM sisters and brothers here, and so that could be one way. Let's see what happens. Give it 2 weeks. Shut down the country, the borders, and just do essential travel. Persons can probably get out, like when we were in government, persons can just go out, and then a period of time you're coming back. But we have to show the people that we're serious.
She added that this new revelation presents the crucial need for the populace to take vaccination seriously and access the jabs.
So you're to take your vaccines. Let's try to intensify our efforts of having persons vaccinated. The first dose, the second dose,
The P1 variant was also identified in Trinidad and Tobago among several patient samples and has been the cause of an uptick in cases and deaths in the country. As a means of containing these incidences, the government at the weekend declared a state of emergency and an 8-hour curfew. P1, the variant first identified in Brazil, is more likely to reinfect people who have already had COVID-19 and is said to be highly contagious. Temika Rodney reporting for the HGP Nightly News.